follow me along. You can follow me along with the with my PowerPoint. So I started as working at SIA 3.5 years ago. I was an associate support helper with the English and the Italian speakers. Then I moved to coaching. So I try to teach and train people about SIA, and then I got promoted to compliance back in May. So here's a little bit about me, so you guys know who you're talking to. So basically, I'd like you to introduce you to compliance, the compliance team, because imagine that meeting someone where you don't initially connect with, but you get to know them better and you come to understand them and then appreciate them. And eventually, with time, you become buddies and you can't live without, their support and their opinion. And hopefully, this is my goal for today. Like you guys, I want you to guys understand what we do so you guys can appreciate us instead of rolling your eyes when we when you hear from us, basically. So to set the record straight, we are not the police of ASEA. Think of us more of like a referee of the game. So our job is to navigate the game and make sure that you stay within the rules. But ultimately, what we help is for you to win the World Cup, right, or the Super Bowl. Depends on what sports fan you are. But as most referees, we're not very popular. But our goal is to ensure that it's a fair game, right? So let's get started. So this is what I put together and explains what we do. So have you ever wondered who compliance is and what do they actually do? So compliance is comprises several individuals. Each one of the is an expert in ASEA policies and procedure. We do a lot of extensive experience with MLM industry. You can always reach out to us. I don't know if you know, but we have an email. It's compliance@asiaglobal.com. We also call people. So if you guys don't want to text or messaging or email, just send me an email and say, hey, I need to talk in person, and then we will call you. No problem. Don't be scared. So one of the primary purposes of the compliance department is to educate our associate on the current policies and procedures. So this can range from a quickly education call to more serious cases requiring an official policy violation letter. And our official title, I don't know if you can see the small prints, is actually Associate Education and Conduct. Is not just compliance, right? So we try to educate people. So let's get into it. So claims. This is basically why I'm here, right? So what you can and cannot say. So this paragraph of the product claim, it is in our policies and procedure, and you can find it in your virtual office under the library section. You can download it if you want, but this is the really part that interests us. So I'm just gonna go ahead and read it. It's a paragraph 362 under the product claims, and it says, it says, no claims which include personal testimonials as therapeutic, curative, or beneficial properties of any product offered by ASEA may be made except those contained in official ASEA literature. In particular, no associate may make any claims that ASEA products are useful in the cure, treatment, diagnosis, mitigation, or prevention of any disease. Such statement can be perceived as medical or drug claims. Not only do such claims violate ASEA policies, but they potentially violate the federal and state law and regulation, including the Federal Food, Drug, and Cosmetics Act and Federal Trade Commission Act. So that's the part that is very important. So I hope that I'm not discourage you to share your testimony and your excitement about ASEA. I'm just here to show you how to. So don't lose your excitement, okay? We all know that people shouldn't make claims that ASEA cure their diseases, heal their wounds, and brought their pet fish back from the dead. But did you know that these rules go higher than just corporate decisions? So some of the people roll their eyes at us, but it's not really us, it's actually the law, right? So we're trying to go, again, like a referee, we want to be a fair game and nobody gets in trouble. So the SHEA basically stands for the Dietary Supplement Health and Education Act of 1994, and the FDA is the responsibilities include the product information such as the labeling, the claims, the package insert. So basically determines what you can say. And then we also have the FTC, which is the Federal Trade Commission that regulates the dietary supplements, supplements, which is primary concern is that the advertised claims about products are true. So let's see, this is just a little thing. So what is a legal claim? So this is what a structure function claims are described in the role of a nutrient or dietary ingredient intended to affect normal structure of function in humans. So for example, you can say support health bones or maintain normal digestions. So these are the key words that you can use. So you can use support, you can use maintain, you can use helps, you can use improve. So these are the very like key words that you will need to use basically for marketing purposes too. And the don'ts. So this is, I don't know if you guys ever saw this disclaimer about the FDA, but basically it says that the statement has not been evaluated by the Food and Drug Administration. This program is not intended to diagnose, treat, cure, or prevent any disease. So these are the other key words. That's what our computer flags. Diagnose, treat, cure, prevent. All these are trigger words that will make your account flag. So for example, when I share my my story about ASEA and I include these words like disease like Alzheimer, cancer, diabetes, or unhealthy status. So like I had a high cholesterol, but I'm taking ASEA and now it's better, then you'll get flagged. So no comparison to drug names like herbal Prozac, no drugs comparison like work as well as this product, right? So we try not to do that. We never tell people to go off their meds, no injuries, and this is the big one too. Sorry, I'm going too fast. Broken bones, cuts, and wounds. So you have to make sure not to mention this as well. Again, there are ways to say things. You just have, to go around it a little bit. And this is another big one that we always have trouble with. Unfortunately, you cannot imply. So in determining whether a statement is a disease claim under this criteria, the FDA will consider the context in which the claim is presented. A statement claims to diagnose, mitigate, treat, cure, or prevent diseases if it claims explicitly or implicitly that the products. So we just need to be careful again. So there is a more don'ts. So like has an effect on a specific disease, like we said before, or signs or symptoms of a specific disease. There is a lot of fine print, and I can send this to you, Debbie or Jackie, if you guys want to share my PowerPoint and my fine prints with everybody. So why can I not say that? So many people have an understanding that supplement industry is not regulated. So hopefully the last few slides have shown otherwise, right? Most of the text has actually been taken directly from the DSHEA. So like this is directly from the DSHEA. In order to protect the company and follow these regulations, compliance must educate associates when their action might be in breach of the policies and the government regulations. And I want to add, I forgot to put it in here. I want to add that, for example, in the USA is the only country that ASEA is registered as a supplement. If you have an associate that is under your line in Australia and is sharing your content, they might get flagged because ASEA is registered as a drink in that country. Sorry, I keep like going forward. So you also have to be careful about the country, the market, and the regulation as well. So let's keep going. So good versus bad.
Esther,
So see, yes.
what is it registered as in Europe?
So basically, USA is the only one that is registered as supplement. It's easier to remember that way. And then in Europe, it's food and drink.
Food and drink.
And then yeah, and Australia the same is yeah, drink.
Drink. Okay. Thank you.
Yes, of course. Um, let's see. So again, good claims, you can say it helps maintain, it regulates. Again, I'm too slow, sorry. It regulates the immune function, or you can say, for example, improves the gut health and digestion. Like all these words are good. The bad one is when you mention like disease, right? So helps relieve severe or chronic pain from arthritis. So there we go. That's the flag. Also, we are in 2024 with a lot of AI, right? Artificial intelligence. Use ChatGPT. If you're not sure, you can just put the phrase in the ChatGPT on Google and say, I want to share these words. Can you make compliant? And then it will just rephrase it for you. And you can also include the country, so it will regulate by the country. And it's very nice. I will suggest that for sure. Let's see. So what do we do when we receive this flag? So compliance is a process in place for dealing with the FDA and the FTC to protect the company and the associates. So we basically send you the email with the policies and procedure attached. We enforce the process. So like we either call you, leave a voice message, or send you the email letter. And then we have to record everything. So basically we save all the conversation that we're having. So that's the enforcement letter. So if we can like find you, or you are living in a different country, we have like different hours that we usually try to send you a brief email that explains what you're about to receive, because we don't want you to panic. We don't want you to roll your eyes at us. This is just education. What we're trying to do is just to educate, basically. So you'll receive like an email that it's very, very, it can be scary because it's very formal. So we try to like contact you before we send you that email. We also do other policy enforcement in compliance. In addition to watching the unapproved claims and testimonials, compliance is also responsible for enforcing policies found within the official company of the policies and procedure. So for example, we try to always look on eBay, Amazon, all these websites for unapproved sales, and see if we can find it, who they belong to, and try to contact them immediately and put them down. We try to make sure that all the associates that have an account with us only have an account per household. And then we make sure that we don't, we're not doing the line switching or the cross sponsoring. And if you have any question about this, I can go in details and I put the description in here. But I just want you to have like a general idea of what we do. We also take care of like sponsor changes, binary replacement. You always send these directly to us, to our email, and we terminate account by request. We take care of like if you need to delete the social from an old associate, we delete that so you guys can re-enroll people. We take care of name changes, the co-applicant, business name, account migration, transfer of ownership. We do all this as well. So this is our email, compliance@asiaglobal.com. And we're always here for you. I also have, I don't know, Debbie, if you have this type of flyers, if you receive this, we are working with the marketing team to put this on our library. So every associate had direct access to it. But basically it's a guide, kind of like of what I present is just explain what a good claim is and what a bad claim is, and then also explain, sorry, let me stop sharing this. Explain the, I lost my train of thoughts. Oh, the income claims. So we also take care of income claims. Unfortunately, we have another type of regulation on that. You cannot say residual income, passive income, six-figure income. So there is like a nice little guide. So I can forward this to you if you want to forward to the team.
Yes, I have several WhatsApp groups that I can put that in.
Okay.
Including, and this will include David Silverman and all those. And I could also send it to the mastermind, which is Denny and everybody, basically. So if you want to send that to me, that would be great. I'll put them in all those WhatsApp groups.
Thank you so much. Yeah.
Yeah, absolutely. Is it okay if I open it up for questions from anybody? Would that be okay?
Yes. Yeah. And if I don't have an answer, I'll just send you an email with a follow-up. Is that okay?
That's fine. Absolutely fine. Do you want to stop sharing your screen?
Yeah. So let me stop
Okay.
sharing.
That way we can see everybody.
1 second. Wait. Why do I?
Go to the top usually.
Oh, right here. Let's see.
The stop share.
My screen.
There we go. All right, so Sandy Stewart has a question. Go ahead, Sandy, unmute.
Sure. No, I was just I've been looking for a PDF of that handout about compliance, because at the 2023 Global Convention in Fort Worth, there was a great breakout session about compliance, and they handed out that really beautiful
Little flyer.
flyer, and I've been looking for the PDF of that. So that would be awesome to be able to have that. That's great. Thank you.
Of course, yeah. And I'm not sure why the marketing team has not put that in the library yet. So I'm gonna make sure that it's gonna happen soon.
Absolutely. And do you have my email? I know you can get it at.
Yes.
Okay. All right.
Yeah.
Perfect. All right.
And I'll CC you, Jackie. Okay, so you're on it too.
Yeah. Yes. I have a question, because was Jackie, I don't know exactly, because I haven't talked to her, I guess, about what exactly, but she was pregnant and telling people she was drinking ASEA. Is that compliant or not compliant?
So on the back of on the label of the bottles, on the back, it says that if you're pregnant, you have to consult the doctor and stuff. So basically, to go around it, she should have put the statement on it. So like the disclaimer, the FDA doesn't approve, blah blah blah. So like all that disclaimer in each videos and stuff.
So if she did that, it would be okay?
It will be better. I need to check if it will be actually okay.
No, I'm asking because there will be people that come along that are, drinking it and they're pregnant, and we want to know if they can kind of say that or not. So yeah.
Yeah, I will for sure. I will make like if you can put the disclaimer, and then I will come back to you to make sure that it won't get flagged. I'll double check that for you.
Okay, thank you very much.
Of course, yeah.
All right. Who else has a question? Anyone? Oh, Dr. Ed?
Yeah, Esther, thank you for coming. And yes, as a practitioner, and what are our limitations, or what are our freedoms in telling people about redox signaling molecules, especially ASEA? Just like the statement where Jackie says, your statement says saying that consult your doctor. If I was the doctor that was consulted and I tell Jackie, yes, you can do it, how can we go around these things?
That's a very good question. I will say, unfortunately, we have a limitation as well because of the regulation of. They have a lot of regulation, right? And we have a lot of flagging for really silly things sometimes that we like. Our team is working on a program basically that takes all the social medias and control all the social media and finds few words, right? So like if they find a word, like you said, that is just like minimum, that we can go back and say, oh no, don't worry about this one, it's not a disclaimer. They're actually talking about and explaining the science about redox and all that right behind it. So we can try to like contest it sometimes. But again, if it's explicit or implicit, then we can get in trouble for it too. So I'm not really answering your question. I know it's very, very hard to go around it. Like basically that's the answer.
If he's doing it in private though, and he would tell Jackie, yes, you can drink it.
All right, that's
That's okay.
the key. Yeah, so
You
that's
just
that's
don't
another
put it in
key.
public, Dr. Ed.
Yes. So there is a lot of Facebook groups that are private and we don't have any regulation on it. So you guys can say basically whatever you want in the private group. It's people that are sharing from that private group that they are a public, they have a public account and people can actually see that they are getting flagged basically. Does it make sense?
Yeah. Thank you again, Esther. I know
Sorry.
these are hard questions, but these are real things happening to me.
Mm-hmm.
I just signed up a colleague last week, and then and she's excited. She wants to talk to patients and everything. And in fact, she already did, and she already consulted me. This was in line of our specialty. She's a family practice. I am a pain management. This is a pain management doctor, and then her patients wants to get it, but she's also does not want her name to be in her website.
Mm-hmm.
So as soon as we did that one, we did it. We named her website as Redox MD, and then we cannot. But the website would still flag her name, her real name, and then her patients would like to order, but she really does not want her name to be there because she doesn't want to be labeled as selling in her office, in the medical office. And her medical office is not owned by, she works with a group. You know how group practices would come and then absorb you, and that is her situation. So she wrote with compliance, because we asked a CS support to do it for us, whether her website name can be what is in the website, really.
Redux.
Redux MD. And as of now, we haven't heard from compliance yet. That was done last Tuesday, and that was the thing.
Oh,
Yeah, well,
it's still the same.
she wrote the websites are still the same, and I talked to her patients already, and they want to say yes, send us the card, and I would like to just send them the card, but and she said don't ever send anything that has my name on it because I really don't want it. I wanted to help this people, this patients, and but I don't want to be labeled as selling things in my office.
Your
Okay.
website can be named that, can it, Esther?
So you can get approved basically by it. So if you send a request that you want to be like a retailer, that's what we call it. You just have to send us the information and we might ask you to send us more after. And then we'll basically just have to have a list of who our retailers are. And there are, feel like you cannot have more than a certain amount. I think that's the regulation. But
Right.
basically, we just need to be informed. That's the only thing. So if you when did you do you know from which email did you send it from, Dr. Ed?
Compliance.com, I think that's what it is.
Is it from your
No, it's
email?
not mine. She did it herself.
Oh,
Uh,
okay.
Told my SEO support, and then they guide me, and they I think first Sam tried to fix it, and then we cannot do it. We were able to change that Redux MD, but the Redux MD is
We
not the one that comes out on the website. It is her name.
mhm.
So
You can there are also regulation on the website. So like if you do want to use our name, I think there is a fee that you need to pay. I need to double check. Because it is possible. I just need to double check the process on that one. If you want, I can give you directly my contact, and then I can after this
yes, ma'am.
Zoom
Yeah,
call, then
I,
we will take care of that situation for sure.
yeah, because I have two people that are really excited about the things that they have not been given hope by their pain management specialists. They have not been given hope by the neurologist, by the things. And I truly believe. And she found somebody that might be able to help her in Dallas, Texas. but that's going to be 12 weeks from now.
Oh,
And she's just looking for something that can help her. And I truly sympathize on her. And after talking, and I said, let's try this. This is what I have. And before you can go to Dallas, Texas, because that's the nearest appointment she got. And so
I
she
see.
was excited, but I cannot share her website because she told me, absolutely, please don't. Because and I also don't want to bog down her excitement because a lot of practitioners, and I think we could create really a group that would deal with us medical
Mhm.
practitioners and how we could help doing this in the field, because as of now it's just like, oh, so good, but hey, don't talk about it. And I said, what can we do then if this is all the things and we have personal experiences but we cannot do it. I just needed help what we do in the field, because there's a lot of us that are also frustrated. There's a lot of us that has hopeless patients that we could not even treat. And we want this to be able to do that. But it looks like there's a lot of restrictions, there's a lot of things that is imposed on us in spreading this and in doing this. Because right now, and I have another one physician that says, let's do this, but of course I want this and this and this. And of course, once we have that, then we kind of stop because we actually don't have. You sign up, you're gonna be on your own, you take the risk. Nobody wants to do that once you say that to them. And if that could, if we could do that, then
Are they still
yeah.
working on an affiliate program? Do you know, Esther?
I think so. Yeah, I'm not sure where they are at, but
Okay.
but it's in the
I haven't
work.
heard anything about that since we came to the founders meeting last December.
Yeah, the things are a little slow, but I really appreciate your suggestion. I think that having a group for practitioner where compliance can help you figure out, I think it's a great suggestion, and I'll bring that up to my team and see what we can do.
Yeah, there's some companies that have experience are nutritional companies, and they have a different division for medical practitioners, and the labels are different, and they're the same product, but it's just like, how can we encourage these people that can talk that really needed this kind of things? Because I myself became a patient of my own specialty. My own specialty did not help me. This is the one that helped me. So when I approach people that are in practice, I said, of course, I have a lot of patients that I already have downloads of medication and nothing is working. And how can, and you could tell that, but there's also protective of themselves
Hmm.
and says, "Oh, I really don't want my name in there once it's labeled that it's a networking and I'm selling stuff." And those are the things that in our practice that we cannot go against. In fact, when we talk about medical things, we have, of course, a disclaimer that we don't have any financial interest in this one that we are recommending. And I think that that's where the thing comes up with the colleagues that I have. But they really wanted it. They're pretty excited. They're doing it because they have kids that are on spectrum and really doing something. So and all of them are just excited. How can we do
Hmm.
this? And are we it's just limited to our personal thing? And
So we for sure want to keep the excitement going. So that's what we are trying to like educate them on how to do it instead of just putting them down. Unfortunately, we are not successful all the time on doing that, but we are improving. So
Doc-
I will.
Could Dr. Ed maybe send you some of his examples of the other company he worked with at one point that just had specific labels for doctors and stuff like that? Would that be helpful?
Yeah.
yeah, I could talk about the company Market America has a nutrition. The biggest things for them is the nutritional division, but they don't call the nutritional division for physicians Market America because would go right away into, it's a networking. So they name it Nutrimetrics just for nutraceuticals, and it's still a Market America things, but the division is just Nutrimetrics. When you go, when you have these things, it's all in a professional labeled way, as Nutrimetrics, because we can carry some things in the office. People, practitioners would have vitamins, minerals in their thing, and then but the resistance that the practitioners have is that, hey, we are identified as a networker, and that loses our integrity of, oh, you're just doing it because you want to sell it, you want to make some money.
I see.
And if we can create the things that, even if they don't, but at least how can we compensate them, even if they don't want to be involved with the whole organization, but there should be a way that they can be compensated if the practice would just say, you know what, we could do this, but how can we bring this to the practice? And then if there's a division in us that can do that, then I guess there is, because we believe in the product. I think this is really the product that has given us hope. We're not saying that, oh, maybe, and just try it. Hey, this is 14 years of proven effects and approved. For me, it's just my own organization. I've seen hundreds of people that have really positive things. So there is confidence in this thing, and
Mhm.
that there is a need, because for us practitioners, all of us that are in practice has patients that has not responded to anything. So that would be the thing to do. What else? I have a lot of questions for you, Esther, and I forgot.
I'm
Oh yeah,
taking
yeah.
notes.
I talked to Tyler once in one convention, and
Mhm.
he pointed out to me, he said, you know what, you are the head of compliance, Tyler, the head of compliance. And he said, you are protected with your own license on what you're going to say. Is that true, though?
That's above my. I'm gonna go back to you about
Okay.
that one. Let me take a note.
Maybe that would be a thing that can go around it, because I, yeah, I wanna talk to you. I want
Also, in which market do you have only USA, or do you have more different markets too?
I have equally, I have a lot in the Philippines, and then
Okay.
we are, we do a lot of positions in the Philippines, and we have a lot of positions there, but I think their resistance again is that, we are in the networking, and these people are just, you know how they are.
Hmm.
They want to distance themselves from a company that is a networking thing, but they're using it, and they're sharing it, and their most closest patients that would not sell them out, and if they know that they are in the networking. So that's the limitations. And but we have here also in the US now, and after talking to this family practitioner, and she was very excited, and then she talked to her patients right away. And then and when I talk to the patients say, yes, send me all these things, and that way I could fill out my form. I just want to try it as soon as immediately. And I cannot send her anything because that my colleague's name is there and her website when we share the cart, and when they press on who's doing this, and so that is the urgency that I have with her. It's just, if we could just do the Redux MD, which is her website, is the one that's going to appear, that this is the website of, not her name, but this is the website of Redux MD. And that's just what we're asking, because her website is approved as Redux MD, but once they open the website, it should not have her name there, but just the Redux MD that's going to be there.
So you're asking to change the personal name, and you do have to do that for
Yes,
compliance.
that's
Okay.
what, yeah,
So
that,
that's what he's asking, but maybe you could, her email is eirvine@asiaglobal.com. Is that correct?
Correct.
So if you copy her name up there underneath her, you could send it directly, and you could tell her the name that you're looking for. So maybe she could facilitate that being done faster.
Yes, for sure. Mhm.
Urban at Sia.com. Morning.
E-urban, yeah. Good.
EIRVIN.
Peter has a question. Are you finished, Dr. Ed, or?
Yes, yes, I'm done. I'm
Okay.
done.
All right, Peter Graham, you have a question?
I got two questions actually.
Okay.
Maybe three. First of all, what is Canada regulated as? Do you know off the top of your head?
I think it's I'll need to double check, but let me see. I think USA is the only one that it's a supplement, but I can double check for you.
Okay. Any movement in trying to get rid of the NRF products?
That's about the market regulation, not so much as SIA. So like if Canada and we have the same problem in Europe. So like if they have different FDA regulations, then we cannot make that change. And this is the way around it using the NFR.
Right.
I was also, if you are not sure, I forgot to mention this during my presentation, but if you're not sure what to share and what to say, if it's like a supplement or a drink or stuff like that, we have a page, the asiaglobal.org for each country. And in that page that we are sharing, the official ASEA page, we put what we can say and we cannot say. So like if you go to Google and you just put Asia Global Canada, then it will directly put you on the Canada market, if that makes sense. And then you can see what you can share and you cannot share.
Okay.
Oh, okay.
The other thing is that Canada has
So performance?
tentatively agreed to follow the WHO regulations and the WFA regulations. What is ASEA doing for that? Because I know that it's going to affect several of my practitioners that are natural, because they're changing the regulations as to who can prescribe, not necessarily prescribe, but it's going to change the vitamin regulations, and I don't know what it's going to do for ASEA.
Usually try to find substance like with the same thing. So like I think we change some of our formulas for the life marks in some of the markets. So we might have to do the same for Canada. You just find a way to make a different ingredient that is approved in Canada that will work the same, basically.
Okay.
Yeah,
Okay.
we have that in different markets, so we will do that for sure. We will try to figure out a formula that works the exact same, but with everything that is approved in that market.
Right. Okay. And how is ASEA prepared for those regulations that come in September the 30th?
Well, those are people that works, in a different department than me. So I'm not really quite sure, but I am sure that they are aware of it and they're working on it, and they must have a plan for it right away.
Okay, fair enough. Yep.
I have a quick question about something completely different as far as that goes, but I just had recently an associate of mine. Actually, she signed up under Jackie, but she passed away. So I'm going to ask a question. I'm going to look at her organization because some people still want to do it and some people still want to do the business. But so if she's got people on the inside leg and she's passed away now, is there a quicker way to maybe move them to the team leg so that they would get support and stuff? I would think you could make exceptions for something like that, but I don't know if you ever do or not.
I never heard of doing that exception because it will be considered like a line switch or like a cross.
Well, it wouldn't be a line switch. It'd be under the same person, it would just be on the team leg instead of her dead, or well, I hate to use that
Oh,
word,
I see.
but her dead leg. It would just be moving them over to the
To the
to the
outside of
active
the,
leg,
yeah.
to the team leg.
But that can impact, those.
Well, they could be at the bottom. It wouldn't matter.
Mm,
So it would.
yeah, sorry, I'm just thinking through of everything that it could impact. Let me figure out, Debbie. Is that okay if I will send you like a follow-up
Absolutely.
email?
Yeah.
Uh,
I'm going to be looking
let
at
me
an
take a
organization.
note. The inside leg, right? Inside. Okay. Okay, I'll get back
That
to
would
you
be
on this
great
one.
because there's some people that are active and I would just like to move them over to get some support. And they'd be, I guess now they'd be under my daughter.
Okay.
But it would be on her right side. So, okay. All
And
right.
just to add to that question, because I also have someone who passed away last month who was an associate. Mind you, this person didn't have anyone underneath him, but I'm thinking if a family member or whoever calls the SIA and has their account terminated, if they did have people underneath them, those people would move up to the next associate above them, would they not?
Yes.
Mhm.
Yeah, so wouldn't that work? In your situation, Debbie?
Well,
Just curious.
Well, they wouldn't change positions. They'd be under,
Mhm,
they're going to be under Jackie now, but it would be on a dead leg still.
mhm.
Okay.
I mean, Jackie doesn't put people underneath
The inside, yeah,
inside leg of this dead person.
Right.
yeah, that's
So they would just be stuck
tricky.
over there
Mhm,
with no
mhm.
support at all.
Yeah, because they wouldn't grow as with the, yeah, I see.
Right.
I will let you know, Debbie.
Thank you.
Yeah.
Thank you.
Yeah.
Mr. All right.
Debbie,
Yes.
if I could, two quick questions. One, we know that the FTC and FDA have been tightening in recent months and have come down hard on some other companies. Has ASEA received any formal violation notices that we should be aware of and sort of encourage us further on proper compliance?
Luckily, no, not at the level, no. We just have to make sure that we have basically a program in place. So like, we just have to show them, oh, we know about this. We know that these things has been shared. We are working on it. We contact them. We send a letter out. We suspend the account if we need to. Like, we just have to show them the process basically. And so far, nothing that major happened.
And so far as you know, no account has been suspended because of uncompliant claims?
No, many. Like, this is not a normal process for us, but it's just not because people don't wanna, do it. Sometimes it's also because they don't have time to do it, so they run out of time, we run out of time, and we have to suspend accounts. But again, we're not the police. We don't want to do that. If we can show like that we have a communication between the two parties, so like between us and the person, we can give more time, because we usually, I don't know if all of you knows, but we contact you and then we send a formal letter out, and we usually give them 10 days. But if I have an email back that says, oh, I'm on vacation, can I have more time? And then we work like this, right? But if I don't have any answer, if I don't receive any email back, or if I don't receive any call back saying that you're working on it, then unfortunately I have to suspend the account to prove to the FTO that I'm working on it, that it's a process in place, if it makes sense.
Great. Okay. Thank you. This has been wonderful. I just encourage you to either have some further information available at the conference in September, and as well as in our back office. That'd be great.
I'll thank you for the suggestion. We usually have a booth at the conference, so I'll make sure that we will have one in September too.
Okay. And then I think Dr. Ed has another question.
This has been in the back of my mind for forever when I lost this associate of mine, and he quit, and I didn't know the rules of ASEA, and when he said that we need to update the registration and everything to keep the center active. And I didn't do that, and so he got terminated. But that position should not complicate anybody because it's already in place, the one that quit. And then, but I cannot reclaim that position. If my question is just, can I reclaim that position? Because both his legs are running good, the left and the right side. And then, but he's terminated. The position is not there. Is there a way to reactivate that in case I have a builder that really wants a position like that, to put them there? Because my thing about it, my confidence about it, because I was the one building both legs, left and on that person's left and right. And so and I'm building it hard because unfortunately I can, there's no other thing to do because they're pretty active, especially the inside leg. I'm already building on the outside leg because that was where I'm building, and then I'm trying to help this inside leg, and we gone through, and she's been qualified to all the promotions that we have. She's been to Ascent for the last 3 ascents, and then so that was the thing. But the original sponsor, now I'm the sponsor, but the original sponsor's position is really vacant. But because that's terminated, I just want to know if we could place a person there.
So
Yeah.
once the account is terminated, we cannot replace this, but we have the time. So we usually give like 6 months before we terminate the account, and in that time frame, that's when you can either purchase that account, so like buy that account out, so other people can buy that basically in. But once it's terminated, we cannot reopen it, and we cannot
Yeah,
yeah,
I didn't have that knowledge before.
before,
If I
yeah,
had the knowledge, and I would have bought it because it is because I would have bought it because I was the one working on both legs.
I
The
see.
right is my common leg, but then the left, which is a very new one, and so I was helping her, and she's good. She went into gold,
Nice.
and I said, "This is my hard work. Why can't I reclaim this sector to do that?" And then, so that's good. And now, one question. I have an associate that is here right now, and she just lost her points because she missed for her children. She missed the and both children are on her left and right side legs, and she missed the monthly subscription.
Okay.
I think weeks, and she would like the points to be reinstated. How could we do that? I know I'm already asked Debbie, and I already asked Amy and Will. All my uplines are being bugged with this because I'm in a panic. And what
No,
do
that's actually a very easy fix. Don't panic. So they just need to call the associate support, depending on what market they are, and they'll be able to make, we call it an exception. We really like do it because we want people to grow in the company, want people to stay in. So we understand that life happens, right? So they just have to call associate support and ask for the reinstatement of their volume, basically.
Okay.
That's the volume or the loyalty points. Like which point?
I think the volume, it's the volume.
On the legs.
Yeah, on the legs.
And they have to put an order in though, too, don't they, Esther?
Yeah,
Yes.
so we will have to open a ticket, and then they will have to place an order to show that they're active. And then we will put basically back the volume in about a week. I think the process usually takes about a week for that, but very easy. They just have to call and say, I'm gonna place an order to show you that I'm active. Can you please put the volume back on my legs? Life happens, you know.
This is in the Philippines, so they could just do a CS support in the Philippines to do that for them.
Yes.
Okay. Hi, Jewel, if you're here, I think I saw you earlier, so that would be the thing that we can do. We can just call a CS support, put the orders there, and that way they could be things. So you getting this, Jewel? Ah, yes, she's having a thumbs up then.
Okay.
Can you unmute yourself and express things or?
Yes. Good evening. Yeah, thank you so much. Actually, I already placed the order, Dr. Ed.
Perfect. Okay.
Okay, you did. Okay. And then, yeah, so good. And then that way we don't have to. But I would really like to talk to you again, Esther, if we could do something about, because the thing is why I see that this is very, very important to have these things, because it is most physicians are really interested in it. I have not seen a response really from any nutritional products uh, than this one, because it is really an answer to what we don't have in our fields. And then if we could have, and if we could do that, and how can we, because I don't know how there's other practices have display of vitamins, minerals in their offices, and they do that. How can we do that here, and help and maybe, yeah, create a medical division in this one, the same compensation plan, the same thing, just relabel it, and then and that way those that are that not comfortable with network marketing can be separated, and then can do this stuff. If we could do that, it would be really a good thing, because most of the hits of this, what we do, are directed towards people's health, and we are the doers really of people's health, and we truly want people to be healthy. And but right now, since we're this, we have restrictions on how to keep them healthy.
Mhm. Yeah, and we want to support everybody, but again, we want to be fair to everybody as well. So we'll have to brainstorm and have a second talk.
Yeah, it's not really it's
Mhm.
just how to get this group of people to to really be engaged. I was engaged accidentally because I just have my own personal health issues, and that's how. I think most of us physicians that are involved with this is because we have personal issues, and we haven't really opened up the thing that can we do this in a different way? Why are we just waiting for physicians to have a personal experience with it? Because majority of us are like that. And but there's a way though, and we need to be on it, and we need to be on it as soon as possible, because and we are growing, even if it's just waiting for personal experiences of different people, but we can. And if there's a way that we could do that legally in compliance and everything, then it can work. I am really very interested with that.
Um, I could work with Dr. Ed, Esther, and get the information to not only compliance, which it would need to go to other, because they'll probably need to create an affiliate kind of a thing to do something like that, but send it to the people that can make this happen, or that can start thinking about it or whatever. I know they've been working on an affiliate program for a while, Dr. Ed. They just haven't quite figured out the payment of it, basically. I think. But anyway, did
It should,
Julia?
it should be the same thing as because the other company did not change the compensation thing. It is just the same. And then the practice is just assigned as a center, and it could be just a center sharing their things. And so the points and everything, it's the same thing. It's just the
Let me
label.
work with you, because they were looking for ideas, and that's what the founders were supposed to be turning in. So why don't I get in touch with you, Ed, and then I
Okay.
can send it to not only Esther, but I can send it to Tyler, who was asking for these things, and
And then
Scott.
and this is open to all of us associate, because
Right,
we have friends that are physicians,
right.
and we have physicians ourselves. We are under the care of a physician. If we do this, then all of us, non-medical and everything, can freely talk to their physicians now. That there is a way that you can have this in your own practice. So this is not just exclusive to us and everything. No, it's just that how can we regular people be able to talk to our physicians, and if there's that way, then it's open to everybody. And that company did not change the compensation plan for this division. It's the same thing. It's just they just created a center to represent that.
Right, so I'll work with you and get all the information, and that's what I can send to them, and maybe this will help them move along and get this done.
Okay, yeah. Thanks, Deb. Yeah, I think that would be a good thing to do.
Okay.
Good.
I don't want to keep Esther too long.
I know.
I mean, there's two more people with their hands up. Do you have quick questions? Because I want to be able to let her go. Julia, I think you had your hand up first.
Yeah, thank you so much, Debbie. This is just an update for you guys because, you know, here in the Philippines recently, like earlier this year, there was a scam on doctors involved bluntly with MLM, and these are actually pharmaceutical companies. So now there's actually a move to regulate doctors joining MLM. Bluntly, I will send you the article.
Okay.
Yeah, there's an ongoing case now with doctors. So I don't know. They were saying that they're gonna regulate. They will make some laws about, you know. So maybe the concern of doctor is really very logical in the Philippines. So
Okay.
it's still a move. There's nothing fixed yet. There's nothing. There's no law yet, but they're very, very strict now.
Okay.
Thank you.
All right, and then Diane.
Thank you. This is a super quick question. It's more of a curiosity thing than anything. So considering that, so redox molecules are native to the body, so I'm just curious as to why in some countries like us, we're regulated as a supplement, like a natural supplement, but we're beyond all natural. So would that solve everything if it was regulated under a native supplement or a native replenishment so just the wording itself? Just curious.
So they have different classifications too, so that's why they just generalize it as a drink instead of a supplement. It's very hard to go into details. There's a lot of markets with a lot of different regulations. And I'm not really sure about the details of these regulations per se.
There's no market that you know of that actually uses the word native as opposed to natural?
No, but it's a good suggestion. Let me see if we can use that, and then let's see.
I know I was told very early on that if they used the bio-replenishment, it would have been even harder to get it into countries because they don't understand this to begin with, and bio-replenishment would have been, you know, made it much more difficult to get it in for the understanding of it. But that's
yeah, and then
like 15 years ago. So
and it's probably still the same though, Debbie. Yeah, and she was saying the native, right? To use the native word. Let me see. Yeah, I'll look into that. I'm not sure about all the regulations and where it will fit in it, so I will double check that.
I just feel like it would probably save us here in Canada because they're really cracking down on natural supplements. So if we're not classified as a natural supplement, that might just save us. I don't know, just a suggestion. Anyway, thank you so much for your time.
Yeah, of course. And we are all welcome to suggestions. So if you have any, just send them over.
Thank you so much, Esther, for your patience, with all the questions, and for your great presentation. And we greatly appreciate it. And it will be passed around. There'll be many more people that will be watching this. So thank you.
Okay, perfect. No problem. And I will send you over those PDFs. So
that would be great. Thank you so much.
Thank you.
All right.
Bye.
Bye, everyone.
Thanks, Esther. Thank you so much.
You're welcome.
All right.